Because I tested.
Here is a list of terms we use. Osteoarthritis is a joint disease that wears on the tissue near the bones, where cardiac muscle means a voluntary straightened muscle that is found in the walls of the histological foundation of the heart, and necrosis is an abnormal condition of death. Total knee replacement is surgical reconstruction of the knee joint by implanting a prosthetic knee joint. Myocarditis is inflammation of the heart muscle, and leukocyte is white blood cells. Bradypnea means reading too slow or low respiration rate, where bariatric surgery means weight loss surgery, and hematuria means condition of having blood in the urine. Bladder receives the urine directly from the uterus and stores it to the excretes by urination. Thyroid gland is the large glands in the neck that secrete hormones regulating growth and development through the rate of metabolism. And neurologist is a medical doctor who specializes in the treatment of the disease of the nervous system. Eyeball, the round part of a vertebrate within the eyelid and socket. And amnesia is a partial or total loss of memory.
Good morning, Dr. Johnson.
Good morning. What do we have for today?
Well, we have 2 patients right now. Right now we have 3 more coming at 10:30. We have one at 1 o'clock, 2 and a returning patient at 3:30 to get the results of her white blood cell count.
Okay, what's going on with the 2 we have now? I see Ms. Jones and Mrs. Smith. What's the history?
Well, Miss Smith, she's in room 10. She's a 72-year-old woman who just had a total knee replacement due to osteoarthritis. She went to the ER last week because she was complaining of cardiac pain in her cardiac muscle. When she got there, her eyeballs was rolling to the back of her head, and she seemed to have a little bit of amnesia. They did a cardio scan, and it showed that she had carditis. They called the neurologist to make sure everything didn't get to her brain, but he said that she was fine, and she will be here today for a follow-up.
Okay, thank you. Okay.
Mrs. Jones, she's in room 6. She's a 52-year-old, 528-pound woman. She just had bariatric surgery. In the recovery, the nurse realized that she was having bradypnea, which was a little bit affected her thyroid glands, acting up, and also her bladder wasn't emptying properly. So they had to do a bladder scan. After the bladder scan, they put a Foley in and realized that she had hematuria, which was blocking her urine. They wanted her to do a follow-up because there's a history of necrosis in her family.
Okay, thank you, Kathy. Hi, Mrs. Smith. I'm Dr. Johnson. How are you doing today? I'm good. Just having a little chest pain stuff. Okay. Were you having a chest pain after? I see that you were having a chest pain after your replacement. I'm going to listen to your heart and check your chest, okay? Breathe in. Breathe out. Does that hurt? I press down. Okay. Is there any history of dementia in your family?
Yes, my dad has it.
Okay, well, I'm going to write you a couple of prescriptions for your chest pain and inflammation. Hopefully it works, and before you leave, I will have the nurse come back in and do your vital signs, and we'll get you to come back in a few weeks, okay?
Okay. Thank you, doctor.
You're welcome.